I want to ask you, Doctor, how is the COVID situation now? We keep hearing stories about the COVID scare, but and we every week when we have a doctor here, we ask about the COVID scare. What is it now? What has it been in the last week?
We are seeing a increase in the number of people having respiratory problems now. Maybe in the past 3 weeks, there's a lot of people having lot of high grade fever, cough, and severe body pains. But everyone whom we advise are not willing to get themselves tested for COVID. Once you're COVID positive, then there is that means what? You have to say, stay away from the family and all. But I'm sure some of them may still be COVID because every summer there is an increase in number of cases, and specifically now all these festivities happening because of Ramadan, and there was Good Friday, then everything where people, huge congregation. Then we had our Ram Navami and all the in Hindu New Year's happening. So, whenever there is congregations, these diseases will definitely see a spurt.
Right, absolutely. And for people like yourself who are on the front line, you'll have to be extra careful. Is that something which y'all are, facing with in terms of taking care of yourselves, also, doctor?
Basically, for anyone, even without COVID also, it is mandatory that whenever you are seeing another person who is sick, you have to have your own precautions in place.
Right.
So if you're seeing someone with a cough, you first cover yourself with a mask and keep a significant distance between the patient and you. And always wash your hands before and after seeing the person. So these are mandatory training for all medical professionals right from beginning. Because if you leave COVID aside, then you have tuberculosis, then you have the regular flu and so many things which patients come with. Now they come to the hospital because they are sick. So we have to take care that we don't fall sick.
Absolutely, absolutely, doctor. So, doctor, over to you for your presentation. We invited doctor to speak about hernia. This is a topic that we've not done in the past, and the request to her was to speak about hernia prevention, care, and cure. And over to you, doctor, for your presentation. And those of you who have questions here, as always, please put them in the Q&A tab. Mention your age and your gender so that we will, doctor would be able to give you a considered response. Even as we wait for the presentation to be ready, and which she will, the presentation will go on for around 10-15 minutes, and then we will go to questions. Over to you, doctor. Thank you.
Yeah. You are able to see my screen?
Yes, doctor. We are able to see.
So, I will be talking on hernia. Now, hernia is a very common surgical problem. And when we are talking to the elderly group of population, then hernia becomes more common in these people. What is hernia? Hernia is an abnormal protrusion of the abdominal organs through any weakness in the muscles. That is our abdominal wall muscles. Once they become weak, then you can see that people develop these types of swelling, small or big, at the different points of the abdomen. And depending upon the location of the swelling, they are given a specific name. Like swelling happening in the upper abdomen is called epigastric hernia, while those happening around the belly button is called the umbilical hernia, and those happening in the groin region could be either inguinal hernias or the femoral hernias, and those happening through any of the scars, previous abdominal scars, are called the incisional hernias. Now, basically, the muscle in this region of the abdomen becomes weak, either because of primary muscle weakness or because there has been surgery and the muscles have become weak there, or the person has some chronic cough, constipation, or is obese or very thin. So all these factors usually lead to the weakness, and then the intestines start protruding through these weak areas, and that is called the hernia. So as I said that common cause of hernias is muscle weakness. Sometimes we may look fit from outside, but our muscles are not strong because of lack of certain proteins. So for those people, even they have seemingly good muscles, their muscles are prone to developing weak areas. Similarly, any raise in the intra-abdominal pressure, so obesity, multiple pregnancies, chronic cough, and those who are used to lifting very big weights in an untrained muscle, and multiple pregnancies, or any trauma to the abdomen. It could be a surgical trauma or any injury can weaken the muscles and could lead to hernias. And as I said, depending upon where they are located, the different names are given so that it's easy for us to mention the site of the hernia and to treat it. So when someone has a big surgical scar, usually in the previous olden days, we used to do most of the surgeries through this big open wounds, what we call the laparotomies. Now, minimal access surgery and robotic surgery have taken over, and we can do most of the surgeries through smaller wounds. But these type of bigger wounds, usually 30–40% of these people who have undergone surgeries through these big wounds end up developing this type of hernias. And similarly, for females, there's a specific risk of developing a femoral hernia, which is a weak area in your groin. And this more happens in the females, and it is high chance of your bowel getting trapped in it. And males have high chance of developing groin hernia, what we call the inguinal hernia. That is because of the reproductive structures which pass through the weak area in the muscles into the scrotum, thereby creating a weak pressure zone through which the intestinal contents can slide down. Similarly, umbilicus is one more weak area. Specifically, we can see in the obese and the multiparous ladies that this umbilical area becomes more and more weaker and stretches, and the intestines then start going into it. So these are the common places where in some people can get hernia, and there are other places what we call the atypical locations where hernias do happen. So any muscle becomes weak, it is bound to create a hernia. So what happens when a hernia happens? You can see through the small gap opening there, we are seeing there's a gap in the muscle, if you can appreciate, and the intestines have come into this through the weak area into the space beneath the skin. This is your skin. So when there's a lot of intestines through the small area, either they can be crushed between this narrow gap, or they can undergo sudden twist. Now that is the dangerous part of the hernia. So whenever we find this gap, it has to be repaired. That's why hernia is a surgical problem and it cannot be treated medically. So neglected hernias can have irreducibility, means the intestine is not able to come back into the abdomen, or the intestine can get obstructed, or the intestine can get incarcerated. And sometimes you can see the color change between this intestine and the damaged intestine. The intestine can lose its blood supply and get destroyed because of the pressure from the getting into a narrow space. So whether a person has lot of symptoms, or some people feel that I only have a swelling, but it's not troubling me, and I will get it operated only when it troubles me, is not a correct thing. So whenever you see a hernia and it is more than 1.5 centimeters in size, then recommendation is that it should be operated. And depending upon the location of the hernia, it is there are different names to the surgeries which are done for this, and usually we use a mesh to strengthen the weakened muscle. Once we reduce the contents which have gone into the hernia sac, we pull it back into the abdomen, close the weak area, and then put a mesh. And more earlier, even these surgeries were done the open way, and it used to cause lot of pain and sometimes wound problems, sometimes the mesh getting infected and all. But now with the advent of minimal access surgery and robotic surgery, we are able to do most of these hernias through this minimal access and robotic ways. And that advantage is that you have smaller scars, less pain, and because of the less pain, you're able to get back to all your regular activities, including going to the office and doing your exercise, and the wound complications are almost negligible. So I hope I have given some broad outline regarding this common surgical problem, because the elderly can be having this problem, or someone in the family may be having this problem, but they may be thinking of what is the solution to this problem. I hope my presentation has been able to give some highlight on this common surgical issue.
Thank you very much. Thank you very much, Doctor, for a presentation that explained everything. Doctor, there's a question that has come in, which is from Mr. Ramesh Desai. He's not mentioned his age. He's mentioned, his question is, how dangerous is it to continue with the hernia problem? Can you suggest precautions to be taken to live with hernia without operation?
No, I would say you have seen the picture, how the bowel gets damaged. So when you live with the hernia, the longer you live with the hernia, there's higher chance that one day you'll end up as a surgical emergency.
Right.
And one thing I would say is, even though it's a very common surgery done across the world, the results vary. So if you're not in the very best of the surgical hands and the best of the clinical settings, your results may not be good. So if you want to get yourself into emergency and then think of getting the surgery done, first is, in an emergency setting, the repair does not happen as well as in an elective setting. Because there's infection there, so we are forced not to use a mesh when there's infection. So you will have a surgery which is not good, and then there's always a life risk when your bowel gets damaged. So I would say there's no way that you should live with a hernia. We see a lot of elderly people whose end of the life event could be a strangulated hernia, that you have kept that hernia for so long, and that is the reason that you're losing your life. And it is not worth to lose life for a simple surgical disease like hernia.
Right. Doctor, the question which I wanted to ask you was that, you have been practicing for, 25 years. Have the number of cases with hernia increased over a period of time? And what are the, are there any lifestyle issues that are causing it over a period of time?
Earlier, I would say that we used to see a lot of hernias because a lot of open surgeries used to happen. But now we are seeing more hernias because of lifestyle changes like obesity and constipation, because people are not eating adequate fiber, so they're continuously straining to pass stool. And then because of so much of pollution, and a lot of people are having these airway diseases like asthma, bronchitis, and all that, where they're persistently coughing. So all these things have again increased the number of hernias we are seeing now. Only the reason has changed.
Right. Doctor, your presentation was very detailed, but we have a question from an anonymous attendee. Is it, with modern forms of surgery that are there, is a hernia surgery absolutely safe, or would you be able to say that the success rate is 100%?
In life, there is no 100%, but yes, definitely with modern technology and persistent training, like if you give all technology to a novice doctor, he will not be able to use the technology. So it is persistent training, persistent effort to improve our skill sets, along with good technology, good anesthesia, good ICU background, and all that. Definitely, our hernia results have improved over time, and they're quite safe. I would say, maybe last Saturday night, I did a lady who was like this obstructed hernia with almost a bowel getting damaged. She kept it for 5 days, and she landed in our hospital at midnight. And I was traveling back from Delhi, so directly from the airport, I took her. It was maybe another half an hour more, her bowel would have been damaged. So it is our commitment that I didn't push her saying that, oh, you waited 5 days, you wait for another 5 hours, tomorrow I'll operate because I've traveled now. No. So it is entirely so many things which are in place now that you can always get the best result. There's no 100% in this world, but yes, I would say that 90-95% of the hernias done in good centers, I would again repeat, good centers multiple times. The results are good, very good.
Right. But doctor, how does one know? How does a layperson know that a center is good or bad?
See, you have to always do a background search. Experience of the doctor, how many surgeries, hernias happen in a month there. So when a center is doing more number of cases, ultimately it is getting more number of cases because the results are good. And when a surgeon does more number of cases, definitely their skill set will improve.
Absolutely. Doctor, we have a question from Mr. Sushil Kumar, who's 76. And he says he has had left side inguinal hernia as well as hydroxyl. Can I get surgery done, and how long is the hospitalization? Is his question.
Yes, he can definitely get his surgery done. And the hospitalization, normally it is a 24-hour surgery. Like you come today, get your surgery done, go home tomorrow. But if someone is elderly and has a little health issues, then we usually keep them for 1 day more. So it is a 1 to 2 day surgery process.
Right. Doctor, this is a question from Ravi. He's asked, can a hernia recur after surgery? And if so, what are the chances?
As I said again and again, I'm saying done in good centers. We always say, when you come to hernia repair, we say done in good centers or centers of excellence. The chances that your hernia is going to come back because of the surgery is less than 1%. But patient factors are also matters. So if someone is obese and they've not lost their weight or not able to lose their weight, and they have got a hernia done even in the best of the centers, their hernia is going to come back. Or someone has associated problems like chronic cough, constipation, which is left untreated, then that will push the hernia to come back. But if all these things are in a correctable stage or corrected, and then you do the hernia, I would say maybe take it less than 2% that your hernia is going to come back.
Right. Thank you. We have a question from Katie Laranchi, who says, Doctor, would wearing a support help a senior citizen when we need to pick up a heavy parcel? Is a hernia surgery done with a small scar? And the second question she asks is hernia surgery done with a small scar through the navel as minimal surgery?
Yes. Now, most of the hernia surgeries are done through minimal access technique. And regarding the support, I could not get the question. If you have a hernia, you're not supposed to wear binders or support because you will crush the intestines, which is lying just beneath the skin, by wearing these what we call the belts or truss or the binders. You should not. If there's a hernia, you should get it treated. You should not crush it by wearing these type of tight fitting devices.
Doctor, I know it's a very unfair question to ask you, but I'm going to still ask because somebody has asked this. Are other therapies like Ayurveda or homeopathy, do they work for hernia?
No. Hernia is a surgical problem. It is if your wall, your main door wall breaks or your compound wall breaks, what do? You have to get it repaired. If you are going to do some puja there or put one photo frame of some god or deity, will it prevent the thieves from coming in? No. So same way, if your means protection to your internal organs is damaged and the internal organs unknowingly are coming out of it and getting damaged, then there is no other way except you have to stitch it back and get it reinforced to keep your intestine safe inside.
Very well answered, doctor. I think that's a very clear explanation of what is. Now, doctor, there's a question from Ravi again. He says, I've heard that there could be some complications which will happen with the hernia surgery. And is that really, does it happen, or is it all, I know you've answered this question about safety, but are there any other, are there any complications that could come up?
You have to see in what stage the person has come to you. You come in the worst of your form for any treatment, don't expect best of the results. So if patients come in a delayed state with the intestines damaged or very big hernia and they're already their heart, lung, kidneys are bad, either because of aging or other medical problems, we anticipate problems, and problems can happen because of these multitude factors. But independently, hernia surgery should not cause any major life-threatening conditions to anyone.
Right. Doctor, there is a question from an anonymous attendee. Are sports persons likely to get hernia more easily?
See, if a sports person has been born with the congenital weak muscles and they are doing a lot of extensive training, which raises their intra-abdominal pressure, and they definitely can develop hernias. Or people suddenly take up strenuous activity without getting their muscles trained, they can have a split in the muscles and develop hernias. So the individual sports person's muscle strength determines whether they will get a hernia or not.
All right. So the thing is, doctor, this is a question that has come in from Lakshmi, who asks, is there something that one must do for muscle support and strengthening in advance so that one doesn't get hernia?
Whether we get a hernia or not is not in our control most of the times, because naturally there are few weak areas in the body which can give way anytime. But we should put all the effort on our part to strengthen whatever muscle we have. So don't gain weight and become obese. And after childbirth, a lot of ladies don't put any effort to improve their abdominal musculature. And if you have problems like constipation or chronic cough, get it treated. And if your muscles are in a bad shape, then don't suddenly try to do vigorous exercises or lifting big weights. For all that, you need to get yourself trained and build your muscle before you set up on doing those things.
And doctor, are there any preventive checkups that one should do just to ensure that you don't have hernia? I'm saying people do go for preventive checkups for various things. Is there something that they should do to ensure?
You can, most of the hernias will be visible from outside. So usually people will start feeling a small bulge or something, which is appearing when they're coughing or straining or standing for a long time. Otherwise, in your routine checkups, usually we have an ultrasound which is done for the abdomen. That will definitely pick up the very small hernias, I mean the small umbilical hernia or a small inguinal hernia, which is starting, we'll surely pick them up.
we have a question from Mr. Sushil Kumar again. Says, I have heard that after left hernia surgery, it recurs on the right side. Is there any medicine or diet to strengthen the abdominal wall?
Once you have developed one side hernia, mainly the groin hernia he's talking about, there's 50% chance your other side is also weak and you'll develop a hernia on the other side. So in our centers, what we do is we always examine the other side. So even if we find a slight evidence of weakness on the other side, we would repair it in the same sitting of as that of the other side to prevent that other side hernia from happening. With a weak hernia on one side, weakness leading to hernia on one side, there's no way you can prevent the hernia from happening on the other side. It will happen.
Right. Doctor, there's a question which is again a slightly tricky question, which is, and in fact, there are two questions which have come. So this is by Ramesh Desai, Mr. Ramesh Desai, who's 75. He asks, how much will it cost in a city like Baroda by an experienced and a reputed good doctor? How much does a hernia surgery cost? Because the general feeling is that the minimally invasive surgeries that have come in, the new forms of surgeries, are a little more expensive than the older form of surgeries.
See, I would say maybe Baroda will be equal to Hyderabad or a little more lesser cost than Hyderabad.
Perhaps the same, yeah.
Same. So if I would say for a single side hernia in the economy class ward, that is the lowest of the cost, the hernia would cost you 1.5 lakh rupees.
Right.
If you are doing it, if you are getting the bilateral, if you have a bilateral hernia, or we find a hernia is there, another hernia is waiting on the other side, then we repair it both in the same sitting, what we call bilateral hernia repair, then that would cost you around 2 lakh for a economy ward.
And of course, if you are in a so economy ward is basically you mean to say a general ward, is it?
General ward.
So if you're not in a room.
Yeah, room maybe will cost you another 25 to 30,000 or another 50,000 more. Depending on the type of room you're taking. You're taking sharing room or single room or deluxe room. That is, according to your luxury rate, the cost will go up. But I am talking of basic treatment, surgery.
And this you're talking about cities like Hyderabad, where where costs are much lesser than in cities like Mumbai or Delhi.
Yes. Infrastructural costs will add, because without proper infrastructure, we can't assure you a good, mainly when we are talking of infrastructure, surgeon skill aside, we need good instrumentation. Then we need absolute sterility, because we are putting in a mesh. And if you are not getting it done in where sterility is not practiced to the hilt, then there are chances that your meshes can get infected. So to give the best result, the hospital is putting in a lot of infrastructure, and it will cost. As the city cost varies, your surgery will become a little more costly, but I would not say it is unaffordable. It is easily affordable to most of the people.